But we're in the hospital, and the social workers meeting with all the people in the ICU, in the recovery unit, to advise them of what their options are. And typically it's about resources for counseling or, more importantly, financial aid, because these injuries are massive. And I would say to anybody, look around, there's always somebody that has it worse. But the social worker met with us and outlining all these things, but it was very quickly apparent that we didn't qualify, because the minimum threshold for getting any kind of assistance, at least in California, is like $24,000 of net income. Well, I made more than that, but not so much that I wasn't going to be impacted by this incident. So I said, well, out of curiosity, what do people like us do? I mean, kind of normal folks. And she said, well, most people get divorced, because if you do that, and she kind of had this glint and gleam of knowledge in her eye, she said, well, then one of you can file for bankruptcy and get all the kind of assistance you would need. And my wife and I looked at each other like, what is this? Right? It was a non-starter. And yet, of course, in these types of incidents, it's like 75–80% people get divorced.
Yeah, that's amazing. That's amazing.
Again, to try to beat the system.
At a time when they need each other the most.
Right. So that was heartbreaking, frankly, because it was almost, she didn't officially recommend that as a course of action, but it was the most financially prudent given the way our system is set up.